Hi, my name is Carolyn Bell and I own the Happy Life Movement Studio in Fort Myers, Florida. I have a studio where we concentrate and focus on body conditioning and corrective exercise that's Pilates based. Our equipment is something new to the industry, or newer I should say, called the Fuse Ladder. Now this workout would be great for anyone who is a little physically challenged. I had a back fusion about 5 months ago, and the client that I designed this home exercise program for has similar issues getting down to the ground as me. So we're going to be working in standing and seated. Now a lot of these exercises you could do without the chair or without that assistance. Now the Fuse Ladder has some of the attachments that you might find in a traditional Pilates studio if it has a tower or springboard. I'm going to be using the roll down bar, and I have the setting slightly above my head, and I have a ball nearby so that I can utilize that. And then I've got the traditional yellow springs here. Our first exercise is going to be a standing 100. So I'm going to come into a Pilates V, and I'm going to bring the bar where I feel an activation underneath my arms and into my abdominals. Now I'm going to stand up nice and tall, trying to lengthen through the low back, and I'm going to move into a flexion in my upper back and neck so that I can begin my pumps of my arms. Ready, and coming up. Now we're going to move to our full body and leg and hips portion. So I'm going to take the ball with me, and I'm going to have a seat on my chair, and I'm going to place the ball just underneath my knees for my body. You could put them above your knees if you need to. And then we're just going to test the movement two ways. Can I bring the bar to my chest for support? And if I do that, can I pull myself up into my squat and squeeze my ball? And so the bar is going to stay in. I'll find my chair, and then I'm going to reach out. We're going to inhale and exhale. Inhale and exhale. Now I may challenge myself by just starting to either come up from standing and find the bend, or I'm going to try and hover and make it a little more challenging on my thighs. So I'm just going to come up and go 1, 2, 3, 4, and down. And again, 1, 2, 3, 4, and down. And again, 1, 2, 3, 4, and down. And again, last one, and coming down. Now we're going to change our hands into an underhand grip. We're going to sit nice and tall, squeeze the ball again, and let's bring that in for some underhanded rows. Now here, you could let the ball go. You could come up onto your toes, and you could start bringing the legs in for more challenge. This could all be done if you were in standing. my, oh sorry, not going to change. We're going to pull into our forehead. And last one, good. And then as before, pull the bar in and assist ourselves up. Now, if you have a solid chair or you have somewhere you can just help yourself with some stability, I'm going to go back to that Pilates V, activate into my Pilates body cues, and I'm going to begin to lift those heels and lower. Of course, this could be done without the hands. I'm going to close my toes. Now I'm in that closed parallel. I'm going to come all the way up, and then we'll add the walking pattern. And last set, good, and both heels up and both heels down. Now we're going to take and unclip our roll down bar. Now if you don't have something that looks like this at home, you can use bands with handles, or your TheraBands. You can, and just find a way to hook them up. Similarly, when I came out of my surgery, I just used the sliding glass door, the handle. So I'm going to be utilizing the left side, and I'm going to come across with my right hand and secure the left one on the bottom. So now I'm going to pull and try to make my bar horizontal. I'm going to stay centered in my body to the center of the ladder or my mat. Imagine sort of taking a hatchet or an axe back and then coming forward. Abs are nice and stable for 2 and 1. Excellent. Now I'm going to level it out. Yes, good. Now there's a little bit of pull here, and I'm going to row that single arm. I'm just going to use my other hand to help me. I'm coming above and below the shoulder, making a big old circle with the elbow. And reversing. Now under to go up. Under to go up. And last one. Good. And then we'll come up, and we're just going to change sides. Finding my chair safely. Good. And now I'm squared up for the first set here, and now I'm going to pull on that left side of the bar, pulling across from the right side. Trying to stay centered to the ladder or your mat. Good. And then we change the bar. So now we can move the ribs a little here. So as you're coming around, you can assist that elbow back with now a little action from the spine and the rib cage and the shoulder. Finding that reverse direction, going down and up, and just making a big lateral circle as much as you can with your elbow. For 2 and 1. Excellent. Now we're just going to unclip, and we'll take that bar with us. Now I'm going to be sitting in my chair. My legs are a little wider, and then I'm going to place it on my chest, and then I'm going to begin to utilize the chair to help me find some back extension. If I'd like to use the arms, I'll just add that. Now I try to have that chair, this is perfect for me, although I don't want to lean too far back and change the distribution of weight in the seat, because this is a very light chair. But if you have a very sturdy chair at home, and just allow my shoulder blades are just on the back side of that chair, a little flexion forward for 2 more. And 1 more time. Good, and then I'm going to turn to face you here. Now we can keep our legs in nice and close. And we're gonna add just that rotation. You could clip a spring if you like. And overhead is always gonna be more challenging than in front of the chest or arms down. For 2 and 1. I'm going to extend that leg out, take a nice inhale, and side bend towards my leg. And coming up and drawing my leg in and all the way through. We'll go to the other side. And remember, you can always choose the overhead position. And then coming here, we'll bring it back up, and now we add that side. And you're going to see my range of motion is restricted here. And 1 more time. Good. And coming through. So we've gotten the lower hemisphere, we've gotten the upper hemisphere, we've done some rotation in the horizontal plane, so we've had a 3-planar. So a great way to just have some movement this week at home or in your studio at home. And thank you for checking in. And if you're in Fort Myers, please come and see us. Thank you.